there is definitely a connection between the oral cavity and the rest of your body, right? I think the links are still being studied and kind of shown. The big links being periodontal disease. So basically, gingivitis has an older brother named periodontitis. So if, like, let's say you have gingivitis, you hear on the TV ads like, okay, hey, if you have, most people have gingivitis. Basically, gingivitis is localized gum irritation. But what happens is if you don't do a good job cleaning your teeth, brushing your teeth, getting all that stuff out from in between your teeth, the bacteria that live in your gums can turn from breathing air to not breathing air. And then when they stop breathing air, they start breaking down the connective tissues and kind of eating those things around your gums, right? When that happens, it triggers an inflammatory pathway in your body. So imagine, like, the analogy I use, the surface area of your gums, okay, is about the size of your hand. Okay, so imagine having an active infection the size of your hand anywhere on your body, right? You wouldn't really like that, right? But then most people that have periodontal disease have the infection the size of their hand, but it's in their mouth, and they don't think about it. So what happens is those bacteria destroy the connective tissue, this inflammatory cascade occurs, and it causes the destruction, the breakdown of the bone and the ligament surrounding your teeth, right? And it's not a process that happens overnight. It takes years and years and years to kind of develop and, keep going. But it's something that is linked, the bacteria that, form there are linked to Alzheimer's disease. It's linked to hypertension. It's linked to plaques that build up in your heart. A lot of the times, if you're getting a knee replacement surgery, you actually need a dental clearance because the bacteria in your mouth can actually go systemic and cause bacterial plaques on your knee replacement and cause it to fail. So there's definitely, links between the system, the systemic health of your body and your mouth. Additionally, like, there's kind of indirect things that we can see, right? So one thing that you notice, okay, hey, if a person is drinking a lot of sugar or drinking a lot of soda, eating a lot of sugar or carbonate, like, heavy carb things, generally speaking, they usually have cavities going on, right? There's breakdown of the enamel in their teeth and their mouth. And then you start asking them the cascade of questions like, hey, what was your last A1C? Do you have diabetes? Do you have hypertension? And it's sort of like all these little indirect effects. So I think one crazy story I have from when I was first practicing, the first year out, I had a person come in and they exclusively drank Coca-Cola. And I kid you not, they had a hole in the front two teeth.
Oh my God.
And it was exactly the same size. And I was like, oh, how do you drink it? And they're like, oh, I sip on it through, just kind of sipping it. And basically melted away a hole in their teeth from the acid from the Coke. And then also the bacteria and the sugar ate away their tooth structure. So it's and I'm sure, like, if you're exclusively drinking Coca-Cola, then you always obviously have other systemic issues that probably come about from that as well.
Wow, I didn't even think about it like that. Are there significant challenges that you see with your patients in the sense that are there certain obstacles for them to not meet a certain dental goal? If you tell them, hey, you need to start brushing twice a day, or you need to start flossing, or start taking, if it's a more severe condition, take XYZ procedures to take care of your dental health. Are there either personal obstacles or systemic obstacles that prevent them from getting the treatment that they need to follow?
Yeah, I think a lot of it is patient motivation, right? So, like, the joke I have, right, is a lot of patients, they floss twice a year when they come in and we floss them for them, right? It comes down to being like, most people, I see them a few times a year if they have work to do or things going on. But 90% of it has to do with habits at home. So brushing twice a day, flossing in between your teeth to kind of get things out, and just being good about taking care of yourself. So, like, one thing that I think people don't really consider when talking about their oral health is snacking, right? So you don't really think about snacking impacting your teeth. But what happens is when you eat some food, right, the pH in your mouth drops, right? So basically the bacteria in your mouth break down carbohydrates and produces lactic acid, right? So the lactic acid drops the pH in your mouth. And because your teeth are mineral based, right? So calcium, calcium based, what happens is when the pH drops, the calcium ions actually leach away from your teeth. And when it does that, your teeth actually become softer and more susceptible to the acid erosion and damage, basically, right? And then what happens is the bacterial plaques, so like the food leftover bits kind of just hang out on your teeth and basically breaks down your teeth. So you kind of wears away. So the analogy I use for that is sort of like your tooth is like a peanut M&M. Okay, so you have a hard, crunchy outside. That's your enamel. You have the chocolate inside below that, right, which is your dentin, and then the peanut, which is your nerve, right? A cavity can start off in the enamel, right, because it kind of has to break through that layer to get through it. Right. You can have a cavity that's isolated just to your enamel, and they can stay like that for years. So if, let's say I see that on your x-ray, and I'm like, Zain, hey, buddy, like you really need to floss and keep it clean. I could see you for the next decade. And as long as you do a good job of keeping that area clean and keeping that area plaque free, that cavity will actually arrest in that spot and stop moving because it no longer has the fuel, aka the food and stuff that you eat, to move forward, right? But let's say you don't listen to me and you still keep snacking and don't floss and don't brush.
Dang, you don't have to expose me like
I'm
that.
sorry, man. I'm using you as a very specific example,
it's okay.
right?
I'll allow it. I'll allow it.
So let's say you don't listen to me, right? And then we allow you to keep going. That cavity will break through to the chocolate layer, the dentin. Dentin is a lot softer than enamel. So even within 6 months, if you keep up with your habits, that decay can travel all the way to your nerve. And then you're looking at a root canal, a crown, a lot more expensive and invasive work compared to just brushing and flossing every day. So the joke is like the deeper into the tooth the cavity goes or the issue goes, the more expensive it gets.
Interesting. Because it's not like this is just some push from a big tooth entity saying, hey, brush twice a day, floss once a day.
Yeah, so that you sell more toothpaste.
Exactly.
Yeah.
To sell more toothpaste, to sell more dental floss, to sell more toothbrushes. It's
Well, you get your toothbrush for free from your dentist, right?
Oh yeah, that is true.
There you go.
But then that's the dental insurance industrial complex pushing you to take advantage.
Well, yeah. I mean, big teeth does exist, right? I
Big
think
teeth does exist.
Big teeth does exist. There's a lot of multinational corporations that are involved in big teeth. But that being said, even if you used, just a dry brush and I don't know, string from the street to get rid of the stuff, it'll still work, right? So like the thing you need to do is consistency. It doesn't matter what toothbrush you use, doesn't matter what toothpaste you use, doesn't matter what floss you use. The idea is just you gotta just get the stuff off your teeth. So if you get the stuff off your teeth, then you shouldn't have any problems.